This is what they never told us. In the history of American medicine, there are triumph stories of breakthroughs, heroic recoveries, and life-saving innovation. But there are also moments when science falters, systems fail, and tragedy unfolds in the very places built to save lives. One of the most haunting examples of this came on a warm spring morning in 1929, inside a world-class institution that prided itself on safety, modernity, and innovation, the Cleveland Clinic. For decades, the truth of what happened on May 15, 1929, has been condensed into a footnote, a mention of a tragic fire. But what many people don't realize is that the disaster was not caused by an ordinary fire at all. It was caused by something invisible, something that filled hallways before anyone noticed, something that turned a hospital, a sanctuary, into a death trap in minutes. Today, we're reopening the Cleveland Clinic disaster files and uncovering what they never told us. Before we begin, make sure you're subscribed to Crimes Through Time if you're fascinated by historical tragedies, hidden investigations, and events that shaped safety standards across the world. Hit the like button, it helps others discover stories that history tried to forget. Now let's step back to that fateful morning. In 1929, the Cleveland Clinic was one of the most advanced medical centers in the United States. Built just 8 years earlier, it represented the future of healthcare, clean, modern, streamlined, and fitted with what was then cutting-edge technology. Doctors and patients alike walked its halls with confidence. In many ways, it was a symbol of trust, a new era of science. On the morning of May 15th, around 9 o'clock a.m., roughly 250 people were inside the building: doctors, nurses, staff, and dozens of patients. There was nothing unusual about the day. No warnings, no alarms, but down in the basement, something silent and deadly was already building. In the early 20th century, X-ray technology was booming. Hospitals across the nation began installing machines for imaging and diagnosis. These machines used a chemical called nitrocellulose, a highly flammable compound used in X-ray film. Nitrocellulose had a dangerous property. It decomposed as it aged, releasing gases that were extremely toxic and highly explosive. Hospitals were warned not to store the films improperly, but at the Cleveland Clinic, thousands of X-ray films were stacked in a basement storage room with poor ventilation, a room that had become a chemical time bomb. On that morning in May, the nitrocellulose finally reached its breaking point. It began releasing nitric oxide and nitrogen dioxide, two gases that are colorless at low concentrations, but turn into a thick, yellow-brown cloud when they mix with moisture in the air. A cloud of poison, and at 9 o'clock a.m., that cloud began to creep out of the basement and into the hospital corridors. The first people to notice something was wrong described a strange smell, sharp, metallic, almost sweet, then a faint haze in the hallway. Some staff reported a burning sensation in their eyes, but no one suspected danger. Within minutes, the haze thickened into a rolling cloud. People began coughing violently. Their eyes burned, their throats closed. Nitrogen dioxide, the same deadly gas used in chemical weapons during World War I, had filled the hospital. Patients were trapped in examination rooms. Nurses were overcome in the hallways. Doctors attempting to help collapsed where they stood. The Cleveland Clinic had become a gas chamber. As the gas spread upward, chaos erupted. Doctors tried to carry patients toward exits, but many were disoriented, blinded, collapsing mid-stride. What made this situation even more horrifying was that the gas was heavier than air. It filled the lower floors first, the most populated parts of the clinic. Eyewitnesses later described it as a yellow fog rolling down the hall. The clinic's staircases became choke points. Those on the upper floors tried to escape downward, not knowing the gas was falling below them. Some survivors made it to windows, smashing glass for air. Others jumped to escape the fumes. Outside, pedestrians saw patients and staff appearing at windows screaming for help. Firefighters rushed in, but even they were unprepared. The gas felled several first responders as soon as they entered. Within just a few minutes, the hospital was filled with poison. At 9:24 a.m., as if the situation wasn't already catastrophic, the nitrocellulose films ignited. The gas explosion ripped through the basement, blowing out windows and sending a fireball through the corridors. The blast spread the toxic gases even faster, shattering glass and throwing debris. Fires burned, but the real killer was still the gas choking, scalding, suffocating. The mixture of chemical smoke and flames turned the building into a nightmare. By late morning, rescue workers finally secured the building. What they found inside stunned the nation. 123 people had died. Patients, doctors, nurses, technicians, and firefighters. Most died not from burns but from the silent killer, nitrogen dioxide inhalation. Dozens more suffered permanent lung damage. Nearly every victim was found near an exit or window, showing just how desperately they fought to escape. The news shocked the world. Newspapers reported the disaster with grim fascination. Thousands attended the mass funerals. The nation grieved with Cleveland. But behind the scenes, questions were forming. Questions about negligence, warnings ignored, laws not enforced, and a cover-up that would try to protect the very institution at the center of the tragedy. Almost immediately, the Cleveland Clinic's leadership began controlling the narrative. They insisted the disaster was an unforeseeable accident. They claimed they had followed all safety standards. But investigators found something troubling. The clinic stored massive quantities of nitrocellulose, filmed improperly in a room with no ventilation and inadequate temperature control. Even worse, multiple staff members had reportedly raised concerns about chemical odors weeks before the disaster. No action was taken. At the official inquest, those details were minimized. Blamed were placed vaguely on chemical instability. No individuals were held accountable. No charges were filed. The clinic continued to operate, and the public never learned the full story, not from newspapers, not from officials, and certainly not from the institution itself. Despite the secrecy, the disaster forced sweeping reforms across the medical industry. Strict regulations on nitrocellulose storage, mandatory ventilation requirements, fire-resistant film innovations, new building codes for hospitals, national standards for emergency procedures. In a tragic irony, the Cleveland Clinic disaster made hospitals safer across the world. The clinic rebuilt, expanded, and today stands as one of the most respected medical institutions on the planet, a legacy intertwined with both innovation and tragedy. But the story of what happened in 1929 has been softened over the decades, sanitized, simplified. What they don't highlight is that this wasn't just a fire. It wasn't just an accident. It was a preventable catastrophe, one caused by human negligence, ignored warnings, and a dangerous new technology that the medical world didn't yet understand. Families never received closure. Many victims were buried together in mass graves. Survivors lived with lifelong health issues. Some were disfigured. Others had permanent lung damage. And for many years, the clinic discouraged public discussion about the event, focusing instead on rebuilding its reputation. Today, few people even know the disaster happened. But behind every modern fire code, every X-ray storage regulation, every hospital safety protocol, there is the shadow of May 15, 1929. The Cleveland Clinic disaster was more than a historical tragedy. It was a lesson paid for with lives, a warning that even the most advanced institutions can fail catastrophically when oversight slips, and a reminder that transparency, not silence, saves lives. Thank you for watching Crimes Through Time. If this story opened your eyes to a forgotten chapter of medical history, hit the like button and subscribe for more deep dives into the past. And tell us in the comments, do you think this disaster was truly unavoidable? Or was it a preventable tragedy concealed by those in power? We'll see you next time. Until then, stay curious, stay cautious. Thank you.